Hello, this is Dr. Taft, and this is another Fast Foot Fact. We're continuing our video series on plantar fasciitis. So last video we went over what plantar fasciitis is, how patients typically present. So this video we're going to talk a little bit about how we diagnose it and what causes plantar fasciitis. Okay, so how's it diagnosed? So most of plantar fasciitis is generally diagnosed by just clinical exam. Patients coming in, they tell us their history, they tell us how the foot feels, and then by us kind of doing our physical exam, feeling the foot, moving the foot around, identifying where the hot spots are, we can, for the most part, I'd say 90% of the time, diagnose plantar fasciitis by just clinical exam. Okay, sometimes your exam does include an x-ray, even though the x-rays don't show us or diagnose fasciitis that way, they can rule out other pathologies that can mimic fasciitis, so sometimes x-rays can be done. Other imaging studies, including an ultrasound or an MRI, can sometimes be utilized as well, but I would say it's pretty rare that we use an MRI for sure. Sometimes we do use ultrasound to, number one, confirm our diagnosis if someone is presenting, not from the standard, or if they've been refractory to care to this point, we may get an ultrasound to assess the fascia to see if it is truly inflamed or potentially look for a tear of the fascia. But I would say the majority of the time, we can really diagnose these by patients just coming in and us palpating around the heel and identifying, where the majority of the pain is. Okay. So once we do identify and we're confident that it is plantar fasciitis, part of, the whole treatment process is trying to explain to the patient and the individual, why they have it, what causes plantar fasciitis. Okay. So fasciitis is the multi-factors that play into what cause plantar fasciitis, but most of the time it's mechanical. All right, there's something about your foot type, how you walk, how you stand, that is putting some stress and strain on that fascia or that ligament that we talked about at the first video. So biggest thing can be shoe gear. So if you're wearing something that doesn't have a lot of arch support, that doesn't have a lot of structure, that can add to the strain and the stress on that fascia, and that fascia then can eventually become fatigued, which can create an injury and inflammation and pain. So we'll oftentimes see this, in the change of seasons. People go, from spring to summer, and they'll go, shoes to sandals or flip-flops, so support to no support, and that fascia now becomes strained and stressed and fatigued, and it becomes inflamed. So shoe gear can be a big component to this. Another big reason why people develop fasciitis actually has to do with the calf muscle. All right, so your calf muscle, is up in this area here. The calf comes down, turns into your Achilles tendon, which attaches to the back of the heel. But there are also fibers of that Achilles that wrap down and attach to the plantar fascia. Okay, so if your calf muscle is tight, it's going to increase the tension and the pull on what it attaches to, which is the Achilles, then and also to the plantar fascia. So if the calf is tight, it's going to put tension on the Achilles and the fascia, and any tendon or fascia or soft tissue structure that's under chronic tension and tightness, and can increase your susceptibility of that tendon becoming, again, fatigued, stressed, tweaked, which again triggers that inflammatory reaction, which then causes pain. Okay, so a lot of times just mechanical. It can be based on, the shoes, tightness in the soft tissue structures, including the calf that attaches to it. There can be predisposing factors as well. If you have a certain foot type, high arched, low arched foot, that can also increase the strain and the stress on the fascia as well. So that can also predispose you to developing an inflammatory reaction. And sometimes there is an acute injury. Sometimes people will, do something in particular and they, feel a sudden pain in the bottom of the heel. Or sometimes people will say that they felt a pop or heard a pop on the bottom of the heel. And so sometimes fasciitis can be caused by a traumatic injury, but generally I would say this happens gradually, it develops gradually, then it kind of progresses over time, and typically a result of just more mechanical issues than anything else. Okay. All right, so that's how we diagnose it. That's kind of how it comes to be. So going forward, we'll talk a little bit more about how we treat it and then some other preventative measures as well. All right, thanks again for tuning in, and stay tuned for another video. Thanks again.